Sam, come in.
How you going? I'm Sam.
How are you, Sam?
I'm
I'm
good.
Sam too.
Oh, you're Sam too?
Have a seat.
Okay.
So what's been going on the last few days?
I've had a headache. I've had diarrhea. I have a sore stomach. It's slowly getting better. I've got a cough and a sore throat.
Okay. So what I'm going to do is I'm just going to have a look over the whole lot of you. We'll
Right.
assess you and see where we're going. We've done your observations. You got a bit of a temperature.
Right.
But everything else looks okay.
Okay, cool.
Okay.
Yep.
Can I just have a look? Generally, you look well. A little bit flushed from the fever.
Right.
Okay. But what I'm going to do is just going to start with your pulse. Okay. I'm just going to have a look at your hands.
Right.
Okay. I'm going to look because you've had a bit of a cough. We're going to see if you've got any cyanosis in your fingers, any clubbing to suggest it's a long-term thing.
Right.
Okay. We're going to look for any swelling. We're going to look for any erythema. We're going to look on your nail beds for any signs of an infective endocarditis or anything like that. Okay. We'll just have a look at the other one. Okay. Wonderful. We're going to look for any whiteness in your nails too. Okay. Well, good. Now, if I can get you, because you've had a bit of a sore tummy, if I can get you to hold your hands up like this in front of you, flex those ones right back there, and I need you to hold them there. And we're just going to check for any hepatic flap, which means that there may be something wrong with your liver.
Okay.
Okay.
Right.
So we wait for about a minute, and a hepatic flap would show as being unable to hold your hands up. But
Right.
you seem to be doing really well.
Right.
Okay. So what I'm going to do now, can I ask you to take your shirt off, please?
Yeah.
I'm just going to give you this to keep a bit of dignity for you there, sir.
Right.
Okay. So what I'm going to do now is I'm going to check up your arms and across your chest here, and we're going to be looking for any scratches or any bruises that shouldn't be there, and some spider nevi, which can mean that you've got a little bit of something wrong with your liver as well. Okay, we're gonna have a look. And while I'm here, I'm just going to palpate the lymph nodes under your arm.
Mm-hmm.
Gonna see if there's any enlarged lymph nodes. Okay, that looks good. Gonna do the same side here. Okay. Gonna palpate under this one as well. Now I'm just gonna have a little look in your eyes here.
Mm-hmm.
Okay. Just gonna look for any pale conjunctiva to suggest you might be anemic. Okay. Or any yellowness to suggest that you might have some jaundice. And just gonna check to make sure that you don't have any rings around your cornea there or any signs of uveitis, which you don't appear to have. Okay, gonna check your general face here to see if you've got any acromegaly, anything to suggest abdominal or a cardiac or a respiratory thing going on,
Okay.
which you don't.
Yeah.
Okay, so now I'm going to go and check all your lymph nodes in your neck. Is
Okay.
that okay?
Yeah.
So we're going to check your occipital ones here,
Mm-hmm.
checking to see if there's any enlarged lymph nodes, your pre and your post auricular. Okay. Doesn't appear to be any. Going to check your submental, which is under your chin here. And then we're just going to check your submandibular, looking for any enlarged nodes which may suggest an infection. Is that all okay? Not too sore?
No, it's not too bad.
Okay. So what I need to do now, if it's okay with you, because you've had a bit of a sore throat, I need to check inside your mouth and just have a quick look at your throat. Got
Okay.
my tongue depressor, got
Okay.
my torch.
Uh-huh.
I just need you to open your mouth for me. And if it gets uncomfortable, too sore, you better let me know, okay?
Okay.
So just gonna have a quick look first, inspect the lips. And I'm just gonna, not really, but I'm just gonna pop the tongue depressor in. I'm gonna look all around. We'll look at your dentition, we'll look at your mucosa, we'll look at your tongue. Can you lift your tongue up, please? Underneath. Wonderful. Pop your tongue down. Okay, now I'll pop the tongue depressor in, but I'm not going to do it, and we'll look at the tonsils. Now this patient's had a tonsillectomy, so shouldn't see too much, but we'll look between the two arches at the tissue that's there to see if it's reddened, inflamed, bleeding, got an exudate on it. We'll look at the uvula to check whether that's central or if it's moved to one side due to an abscess. Okay, thank you. It looks a little bit red, but you haven't got tonsils, you haven't got any pus or anything like that, okay?
Okay.
So what I would do now is I'd put on a pair of gloves, which I don't have, and I would feel Sam's tongue. So I'm going to feel his tongue for any masses, and I'm going to feel in underneath his tongue to see if I could feel some glands under there, any lumps, bumps. I would look for any candida as well, or leukoplakia, which would be on the inside of the mouth resembling white. Okay, so that all looks pretty good. I'm gonna have a little listen to your chest now. Is that okay?
Okay, yeah.
Just because you've had this bit of a cough. You been coughing anything up?
No.
No. No? Okay. So I'm just gonna inspect the chest first, just from the front here, and I'm gonna take a big deep breath in for me. Wonderful, and out. Okay. And I'm gonna inspect for any tattoos, any lumps, bumps, equal expansion, that kind of thing. Any marks that shouldn't be there. Okay. Shape, there's no veins, there's nothing like that. I'm just going to have a little listen to your chest, okay?
Okay.
I want you to just take some deep breaths in and out through your mouth.
Okay.
Okay?
Yeah.
Okay. Okay. So I'm listening for bronchial sounds. No adventitious sounds that we can hear. Okay. Is that okay breathing like that?
Yeah.
Yeah, okay. Now I'm gonna percuss. Okay, so I'm just gonna have a little tap. The dullness of the cardiac window there. But it should be uniform most of the way down. Okay. Now, and that's going to sound really weird, but I need you to say 99 every time I put my hands on your chest, and this is testing for fremitus, and it needs to be uniform all the way down, not less or more. Okay?
99. 99. 99. 99.
Wonderful. So if there was a higher or a lower one, could mean that there's some consolidation or some air in there. Okay, I'm going to do the same for the back here, so if I can get you just to lean forward for me.
Right.
Okay, I'm going to test for expansion.
99.
So take a deep breath in for me. Wonderful, and out. So there's equal expansion there. Okay, inspecting the area, any flail segments, which obviously he's not going to have. And I'm going to have a little listen to this. I just need you to breathe in and out for me. Okay?
Yeah.
Just normally. Wonderful. Oh, if I can get you to just pop your arms, just cross your arms in front of you, just say thank you, just so I can hear through here. Yeah. Okay, listening for any wheezes, crackles. Wonderful. Okay, I'm going to get you to say 99 again for me.
99, 99, 99, 99.
Wonderful. Then we're just gonna have a little listen now. Wonderful. So that sounds pretty good. Okay. You can remove your arms down now.
Right.
Okay. So now, if I can get you, I'm going to have a little look at your tummy.
Right.
So if I can get you to lay down on the bed for me and just pop the towel across your middle bit there.
Okay.
Okay.
Right.
Swing those legs up.
Okay.
Wonderful.
Right.
Just make sure that you can see this. Okay. So what I'm going to do, we're going to have a little look, and I'm going to look from the side and see if we can't see anything. I'm just going to pop that down there, keep you nice and comfortable. Okay,
Right.
just going to have a look at your tummy, see if there's any masses, hernias that are poking out.
Right.
See that it's even, if we've got any redness or bruising or anything like that.
Okay.
It looks okay?
Yeah.
Okay, so where's the sore spot?
Down here on the right side.
On the right side, okay. So what I'm going to do is I'm just going to have a little press of your tummy. Is that okay?
Yep.
Yeah? So we'll start over here first.
Okay.
Is that okay?
Yeah.
Yep.
Yeah.
And I'm just going to have a little, no, we'll just keep going. Is that okay?
Yeah.
Okay. Is this sore here?
Little.
Yeah, okay. So what I'm going to do now is just a bit of a deep palpation. Okay, you shouldn't be able to feel the spleen on a normal person. Just roll onto your right here for me. No, can't feel that spleen. Wonderful. Pop back onto your back for me.
Okay.
Gonna have a feel of the kidney. So I'll blot the kidney. Is that side okay?
Yeah.
Yep. Okay. Gonna have a feel of this kidney.
Ow.
That's sore. Okay.
Yeah.
And I'm going to have a little feel down here into your groin. Is that okay?
Ow.
Yeah, okay. Is it worse when I push in or is it worse when I let go?
Push in.
Yeah, okay. Okay. And I would have a look in the inguinal area to see if there's any inguinal hernias as well. I'm just going to have a little listen to your tummy. A little bit of air in your tummy there. Okay. And I'm going to have a little listen for renal bruise and bowel sounds. So I can hear normal bowel sounds there. See if I can hear a bruise, which I can't. And the hum of the liver, which I can. So we've got bowel sounds. Okay.
Okay.
Now I'm going to do a few checks for appendicitis just to make sure it's not your appendix.
Yeah.
Okay. So I'm going to push in Rob Singh's sign over here on the left. Quite deep. Not sore on the other side?
No.
No. Wonderful. I need you to lift this leg up and I'm going to push down against it. Is that sore?
Little.
Little bit? Okay. And now I'm just going to do another little test. Just let me lift your leg up. I'm going to bend this knee for me and I'm going to push that in.
Yeah.
Is that okay?
Yeah.
Okay. Pop that back down. Okay. So if you can stand up for me. I'm just going to check your back.
Right.
So I'm just going to get you to stand there for me. I'm just going to palpate all your vertebrae. Do they feel okay?
Yeah.
Yeah. I'm just going to get you to do some movements because you said you've got a bit of a sore back. Can you bend forward for me?
Right.
Is that okay?
A little sore.
Little sore, sorer than normal? Or?
A little bit.
Okay, now bend back for me. Wonderful. Sideways. Excellent. And sideways this way.
A little sore.
Okay. Okay, have a seat there for me. Okay. So the differential diagnosis that I should have actually said at the start, sore throat. Sam could have had a viral pharyngitis. He's had his tonsils removed. He could have an Epstein-Barr virus, and he could also be irritated by smoke because he does bookings for an entertainment company, so he may be in night spots where there's cigarettes. Serious things to not miss would be obviously neoplasm, angina, a foreign body. Often missed an oral STI, although he does have a partner. Candida, thrush, or a reflux esophagitis. Sam is on a proton pump inhibitor. He's also on naproxen, which can cause reflux and agranulocytosis, which we would look for as well. His cough would most probably be an upper respiratory tract infection, but it can again be because of irritants, smoke, like sinusitis. Serious things not to miss would be a lung cancer, TB, COVID, influenza, foreign body, and reflux can also cause a cough. Now his belly pain, diarrhea, gone to the flank. Probabilities, because it's on the right hand side, it could be his liver, could be his appendix, could be a gastro because he's a swimmer, it could be some sort of waterborne virus, irritable bowel syndrome, Crohn's, a pyelonephritis, a UTI, a renal calculi, or colic. Obviously, miss peritonitis, a small large bowel obstruction. Also, a post-strep glomerulonephritis, which is caused from a sore throat and can cause all sorts of issues with your kidneys and stuff like that. Often missed, sacroiliac joint dysfunction, a fecal impaction, a myofascial tear. I think that Sam probably has renal calculi colic, which has caused maybe a pyelonephritis or something like that. His treatment would be, I think he's probably got a pyelonephritis. His treatment should be fluids, some antibiotics. He's allergic to penicillin, so you would probably start with a Bactrim type drug, regular paracetamol, regular ibuprofen. I think that's it. Thank you.